Welcome everybody that's joined us. We're just going to wait another minute before we kick things off. How's the weather in Colorado, Sarah, while we're waiting?
We had a little snow overnight, pretty chilly. I think maybe in the high 40s this morning, but it's been closer to 20 in the morning.
Oh my God, if this Galaxy Vet thing doesn't work out, you could totally be a weather girl. That'd be awesome.
Thank you.
Or maybe a vet,
I don't have weather behind me, but
yeah, exactly. You could though. That would be sick. Oh, yeah. I think it would be a challenging job to be a weather person, really, to imagine talking with your hands and over here. I couldn't do it.
Oh, the amount of body awareness, if you see it done really well,
yeah.
How do you look good in that position while talking about the weather in this intelligent way? I don't know, but I always did joke that if I wasn't a veterinarian, I would be a meteorologist, because I kind of I like clouds and weather and storms and things.
Yeah, me too. Well, I guess with that, we're 1 minute over, so let's get started. So you've got the, just so everybody knows, we just covered the Fort Collins, Colorado weather forecast, and now we're going to jump into talking about this webinar that we've got our hands here. So welcome everybody. My name is Shawn Wilkie. I'm super excited to have a friend, Dr. Sarah Wallace from Galaxy Vet here with us. We're going to start the presentation. And with about 10 minutes left, we'll do a Q&A. Super excited about everything that we're going to talk about today. And then at the very end of our presentation, we're going to do a little quick demo of Talkatoo. Feel free to stay around, come off mute and ask questions during that time. And also, any questions you got for Sarah, she'll be happy to answer them. So let's move right on to our topic. So today, Sarah and I are going to be talking about telehealth. It's a big topic. I've talked a ton about it on my podcast. I get pretty excited about, I think, what telehealth can do for the industry. And really during the pandemic lockdown that we all are trying to block out of our psyche, clinics had to rethink how they were providing services to their clients. Telehealth kind of emerged as this thing that had a ton of potential. It's looking like it's going to stay around. I think there's lots of long-term kind of implications for telehealth in veterinary medicine. It offers access to care for pets and owners, reducing costs and traveling and unnecessary movement of people. It helps people, with the underserviced pet population get better access to care. And this whole idea of virtual care, I think, is really being embraced. So during the session today, we're going to cover how your practice can benefit from telehealth as a complementary tool to the on-site services that you currently are providing. Some tips to help work telehealth into your operations. And so super excited about this topic. I think it's going to be fun, Sarah. And besides, we haven't really properly caught up since that night in Fort Collins. So it's going to be nice to have a really long chat with you. Looking forward to it. My name is Shawn Wilkie. I'm the host of the Veterinary Innovation Podcast. I'm the CEO of this great company called Talkatoo, which we'd love to tell you a little bit more about after our webinar. If you haven't heard about Talkatoo, we offer veterinary dictation software that takes the hassle out of typing medical records and doing documentation. And now, without further ado, let me introduce you to my friend Sarah, Dr. Sarah Wallace. Sarah is a veterinarian, a telehealth expert, motivated by the belief that through design, thinking, and genuine care about veterinary teams and telehealth, in this industry, she's a bit of, I would say, an innovator, a bit of the fabric of how telehealth even got started. Prior to joining Galaxy Vets as the Vice President of Telehealth Services, Sarah was very early in her career. She burnt out, and I know all about it because we talked about it that night in Fort Collins. But she found her niche through burning out. She found telehealth and became an expert in the field. In 2018, she helped Fuzzy Pet Health successfully build and launch a nationwide standalone telehealth platform. Soon after, she helped Modern Animal build and improve their hospital integrated telehealth solution. And I know a bunch of people over at Modern Animal. These experience, along with her desire to create a sustainable work environment for veterinary professionals, has shaped who Sarah is. Sarah is ongoing, committed to finding ways to use telehealth to increase access to care and to navigate the workload of veterinary teams. So that was a lot, Sarah, but it's all true because I knew about it before. But let's jump right into this. So tell me a little bit about yourself and what brought you to the field, and I guess what ultimately made you passionate about telehealth.
Well, first, thanks so much for having me, Shawn. And yeah, I mean, you kind of went through my CV version of what brought me to where I am. I have a couple of very short stories that I can tell to show the evolution of my interest in both access to care and telehealth. So the first one has to do with when I was a veterinary student, I found myself in front of an interview panel of doctors, let's say older male doctors who asked me if I had a pet in front of me that needed emergency surgery or it was going to die, what would I do? Small detail, the person couldn't pay for care. So I stopped and I said to my answer was, well, I would figure out how to get that dog care. It's kind of a cop-out answer, but as a summary, you figure out how to get the dog care. And the one doctor looks at me and he says, "You're not going to make very much money as a veterinarian, are you?" And at that time, I'm still looking for a really good comeback to that comment. But what really that was for me was my first gut check moment of I'm not okay with pitting my salary against the life of a pet, an access to care issue. The second story is actually a couple of years later. It was between my first and second year of veterinary school. I was working at a small ER clinic in New Hampshire, which is where I grew up. And I was just an assistant, but I answered the phones when the receptionist went home at the end of the day. Someone calls in and says, "My dog just had 8 seizures in the past hour. What do I do?" And I said, "Well, you need to come into the clinic." And she said, I don't have the money. Are you really going to let my pet die?" And everyone who's listening to this webinar has heard that sentence before. And it's not fair. It's not a fair sentence for anyone to say to us. But at the same time, if you put your feet in those shoes, that person is scared for the life of their pet and they can't afford your care. And that's not our fault, but we're just dealing with a fear of a person being able to afford care. My second time that I had a gut check of an access to care issue where there's not a bridge for that person. And the third story has to do with actually when I was first working at Fuzzy Pet Health. This was a company that was doing in-home wellness appointments for people in San Francisco. And they had a young telehealth service at the time. I was working the telehealth service and we had someone write in. So this was an app where you could text with our team. And so this person writes in from, I think it was Arkansas. And she said, "My dog's having seizures. What do I do?" Okay, well, what's going on? So we take a history and get to a point where I realize sort of at the end of the history that this dog had just had puppies and she had not offered that information before. So then I say, "Okay, well, how many puppies?" And she said 10. I said, "Okay, what are you feeding your dog?" "Just adult regular dog food." And I think any veterinarian would know where I'm going with this, which is this dog probably has hypocalcemia from the number of puppies it has and what it's being fed. And of course, I don't have VCPR with this dog because they're in Arkansas. So what do I do? And so there's a little bit of fine print you can go to in VCPR laws, which is if you think the life of the pet is at stake, you can potentially provide care and there's not any legal repercussion for that. So I said, "Okay, well, let's get some informed consent. Do you understand the best care for your pet is in an emergency hospital right now?" "Yeah, I can't get there." She basically said the closest ER was 3 hours away. She said that she didn't have a car and she said she didn't have more than $10 to her name. Okay, but do you understand that that's the best care? Do you understand that I can try to help you, but your pet may die? And once I got that informed consent, I basically said, go get some Tums, go get some Caro syrup, go get some puppy food, and basically gave her a treatment regimen at home. And that dog actually lived. And of course, it wasn't seizuring. That was the chief complaint, but it was tremoring from this hypocalcemia. So that was the first time I could actually save a life through virtual care. And the first time I saw how access to care could really be provided through telehealth. So that's sort of the development of my passion for both of these areas.
So people say that we have light bulb moments. It sounds like you had flashing lights going off in your mind, which is pretty cool. That's fascinating. And to see that, you know, I think, you know, the thing that people don't realize about telehealth is telehealth has existed since the telephones existed. Like,
Yeah.
you know, like let's check ourselves here, right? Veterinarians have been doing this stuff for decades. And I think that, you know, just because maybe it's not comfortable, just because it's maybe not the norm, I think that there's been resistance to it. But then all of a sudden, you know, flashback 2 years ago, 3 years ago, you know, there's a global pandemic happening, and we're not even sure if it's safe to go outside. We're not even sure if it's safe to do anything. And so, you know, Sarah, when you think back to the pandemic and when it first started and where you were at in your career at the time, you know, this idea of telehealth and virtual care must have just been, you must have been thinking a lot of different things. Can you kind of help maybe kind of like back us up and, you know, where you were at in your career at that time and what you saw changing and, you know, kind of what you saw the future might look like? And then we'll try to speed up to modern day here in a minute.
Yeah, sure. So during that time, I was, I had started working with Modern Animal just after the pandemic started. And what I was seeing with a lot of veterinary clinics is they were solving for this in a couple of different ways. One was curbside and the other was telehealth. And I sort of look at those two options as a technological solution to a problem, telehealth, or a workaround, curbside. And the workaround isn't necessarily doing a whole lot different, but it technically is using your resources in a different way. Like people couldn't call out as much as they wanted to or needed to actually communicate with pet owners. So phone lines got all jammed up. So if you had more of a asynchronous communication or a communication like text messaging, where I can text to you when you're done with your meeting or what have you, you answer me back and then we can complete a conversation. That's a way to get information to someone on their time, something that works for them. And then when they come back, same with me, I'm busy too, but I can get that message and get to it and then respond to you. So that's sort of the written version of telehealth. But also having these video appointments with, you know, we had all of these pets needing to be seen, but less time because of all the communication that needed to happen, the curbside aspect, the going out to the cars. So seeing some of those patients virtually through video calls, we were able to say, start to scrutinize, does this pet need someone to actually touch them or not? Or do they need to have a conversation about their diet or an ongoing chronic care medication or what have you? And then sort of start to parse, these things need to be seen in clinic and these things could be seen virtually still by a doctor, but they're still going to get the same information just in a different way. So that's really where the next piece of telehealth, where it's not just access to care, it's about changing a workflow and making room in that appointment schedule for all of your patients.
So let's chat about that in a little bit more depth. We'll somehow get to the future here. We'll find our car to get back to the future in a minute. But I want to take us in a different direction and talk about specialty care. And you know, when we talk about specialty care, I think it's a great thing to pair up with access to care, access to specialty care. So, you know, maybe there's somebody on the phone that has a rural practice in Arkansas or Nova Scotia or somewheres that's, you know, they've got to come out of the woods to hunt. There's maybe a vet practice 100 kilometers away, and their pet really needs a neurologist. So what does telehealth look like today if a pet needs specialty care? And how can veterinary clinic owners, people in the industry, how can they start to shift the way that they're thinking around specialty care when they pair it up with telehealth?
Mm. Yeah, great question. So this is a really exciting area, Shawn, because I can see a place where, so everyone thinks about telehealth as being between a pet owner and a veterinarian. But really telehealth can include what's called teleconsultation, which includes a conversation between a veterinarian and a specialist, or a veterinarian and another veterinarian. It happens all the time. It happens on Facebook. It happens in text messages between veterinary school buddies. But what it can be is when that person in front of you says to you, I either can't afford specialty care, I can't get there, whatever their excuse is, you can say, okay, let me talk to a specialist about this situation, and then I will take over that specialty care under their guidance. So that's there's so much potential for continuing that care underneath your roof with extra. So you're not only getting that pet the care you need, but you're getting an education one-on-one with a specialist, which is really cool.
Yeah, it's super exciting, right? Because you think of these relationships that the veterinarian has with their clientele and the pet, and then all of a sudden, not only like is this new avenue opened up, but you can prevent that client from driving. Like we had somebody, me and Ivan, on the innovation podcast, we had somebody that was doing specialty tele consultation work. And she told of a story where this pet needed a neurologist. And she was this little old lady that was in her 90s was driving 3 hours to go see a neurologist for this pet that she loved so dearly that she could afford to pay for the specialty care. She wanted the specialty care, but it was 3 hours down the road. And that 3 hours down the road might be 15 or 30 hours down the road, or completely inaccessible. And I think what a lot of people in veterinary medicine forget is that there is people that want that level of care. There is people that can afford that level of care. And if you make it accessible to them, it represents a new revenue stream for your veterinary clinic, and it allows you to produce better patient outcomes. It's just like the best of all things that one could think of.
Yeah, I 100% agree with you. It's so exciting, and it's such an interesting way to, if you think about veterinarians needing, needing continuing education, like that. This is a way to, if it could be done in the States, I'm not sure, but it could be a way to have veterinarians learn from a specialist one-to-one if they can figure out how to actually get credit for that learning time. That's not my idea. That's a new idea.
That's a big idea. I like it. So I guess now future state, like I keep promising to take us back to the future. So here we are. What is the current state of telehealth? And if people are on this webinar and they're thinking to themselves, I keep hearing about telehealth, we haven't really done anything, what should they be doing at a minimum, Sarah? Like, to provide better access to care, to serve their clients better, to maybe give their staff like a better work environment. Like, what are the table stakes today that if people aren't practicing telehealth in this way, they should really, after they leave our webinar, start thinking about it?
Okay, great question. So I am a very strong believer that teletriage is going to be a huge difference, a huge change maker for our industry. And teletriage, for those of you who aren't aware, it's triage, just like, at an emergency clinic, you take a history, understand the severity of the condition at hand, and kind of take the most critical patients first. It's a similar idea, but say when your clients call into your veterinary hospital, they get to a nurse or an RVT who is going to triage them. Instead of that client saying, I want an appointment, and putting them in the appointment schedule, they say to them, we're going to ask you some questions and understand what your need actually is right now. And when they're triaged, then they get a recommendation at that point. I think you need to be seen today at an ER. Yesterday, you need to be seen this moment at an ER. You should probably be seen today, tomorrow at your clinic, or actually, you probably don't need to be seen in the clinic for that particular thing, but we can have a doctor talk to you virtually. And imagine if you could parse your clientele that way, because then what you're doing is you're taking everyone. So the original state was anyone who called in, or most people who called in, end up in that appointment schedule. Then imagine now you've parsed them. You've said everyone who needs to be in your appointment schedule gets in there. Everyone who needs to go in ER, you're sending them to ER before they come in your door. And then anyone who could have a question or something that could be handled virtually is seen virtually. Then everything that used to be seen virtually was in that appointment schedule. You've pulled those out, and now you have more capacity in your hospital. You've had those conversations virtually, and now those things that call in same day and need to be in, there's room for them in your appointment schedule. So you're starting to address what used to be the squeeze-ins or the accommodation appointments, and taking those and putting them into actual appointment slots. So there's actually time to have those conversations, those diagnostics, those treatments. So
Yeah,
that's what I'm experimenting with now.
it's amazing because it sounds like, organization equals more capacity equals more profits, more capacity also equals keeping your clients happy. So it seems like, what you're trying to say is this is a no-brainer.
I think it's a no-brainer. I really do. And your clients, I know everyone's read, clients love it. They do. They love having someone to talk to because, one, if you have a telehealth team that's having communication with them, they have time. Those clients have time to digest what they're being told. They have a written transcript of what they're told. And usually they have their expectations being set for them. So you're not saying to them, go into the clinic, go into the ER, like goodbye. You're saying, this is what I think's going on with your pet. And so that's why I need you to be seen right now, or I need you to be seen by tomorrow because X, Y, and Z. And so if you take that one step further, what you're actually doing is saying, I always give the example of a dog that is squinting. It's one of its eyes. So what I would do with that patient is say, I really need you to go into the clinic within the next 24 hours. I'll help you get that appointment slot booked up. But here's why. There might be something there that's an issue that could cause blindness. So when you go in, that doctor is probably going to recommend 3 different tests for that eye. I don't have to say what they are, but I can say that they might go, depending on what they see, they might recommend up to 3 of those things. And then when that person goes into that clinic and they hear the same thing from your doctor, your in-clinic doctor, then they go, it's almost like you've built in a second opinion into your own clinic, where they go, oh, that's what Dr. Sarah said too. Okay, that makes sense. And it's like you've almost broken a barrier, like you've created trust in saying, this is what you can expect. And then when they hear it again, they're more willing to go ahead and say, yep, okay, great. And that's the feedback I've gotten from doctors in clinics is it was so easy to just say, this is what I want. And they agreed to it.
It's fascinating, Sarah. I mean, we both lead people, we both lead people, and we're both leaders. And a thing that I know as a leader is when I say something, say I say 10 things to anybody, really, really smart people are going to hear 7 of the 10 and like clue in to those 7 of the 10. And so by having this preemptive conversation, you're avoiding those like, well, do we really need to, because you're starting them on the path to like understanding that this is the treatment path.
Mm-hmm. Yep. 100%.
That sounds super fascinating. So, the flip side of that question is like, why the hell wouldn't people do this? Why are hospitals not gravitating towards this? Why are people not implementing some kind of teletriage into their day-to-day hospital operations?
I honestly think it has to do with just the sheer number of patients that veterinary clinics are seeing at this point, and the amount of work that they're dealing with. I know, back when I was in clinic years ago, before it was as chaotic as it was now, I would get to the end of my day, and I don't know if you ever experienced the like brain dead state of like your brain being numb. You've just thought too much that day.
No,
Like
just a little bit this morning. I actually said Happy Friday to a group of people today. So
exactly. Or you're like, your partner says, what do you want for dinner? You're like, I can't even make a decision right now. I don't even know. It's just decision fatigue like crazy. And so at that point being like, okay, it's the end of the day. Telehealth, let's start and try and figure that one out. Like, I just don't think that there's a great place for people to know where to start. And
yeah,
just,
I would offer a suggestion to anybody that kind of is paralyzed by the amount of work that they have. Um, Take a day off and work on your business, not in your business. It's incredible. And and everybody feels like they can't do it, but we all can. We all have the same amount of time as everybody else. And a day where you sit down and maybe you absorb some of the content that we're talking about today, and you're like, okay, we're going to start teletriage. We're just going to do it. We're just going to like have people answer the phones, and instead of booking people for appointments, we're going to triage these customers, these patients. And maybe there's even some resources that Sarah has like put together to like help you think about this, because we talked about it. Maybe you haven't, Sarah, but I think that it's a really important thing just to step back from like the brain drain that is every day, and just think about working on your business as opposed to in it. So I think one of the things that like comes up often when talking about teletriage, telehealth, is access to care. And I just had the coolest conversation on my podcast today with Ivan about access to care and some new ways of thinking about it. But I want to talk about access to care as it relates to telehealth, teletriage, and how do you think that plays into people being able to access care? Because I heard of a story a couple of weeks ago. Somebody had a new kitten. They wanted to take it into the vet clinic. They called the 5 clinics in their town, and all 5 of them said that they weren't taking new patients. That's a bit of a problem. So how can telehealth play a role in making care more accessible?
Yeah, question. So first and foremost, I already mentioned telehealth is about access to care because it's about helping people understand if my pet is sick, or if I'm a pet owner and my pet is doing something weird. So I'll answer this question with a little bit of a visual analogy, which is there was an Instagram video going around. I'm sure it was on social media and other places, but it was this golden retriever that was upside down on its head, with its back against the couch, and its back leg kind of, up in the air, was dangling down, and it was gnawing on its back leg. And it was a funny video because this dog's just being a goof, right? And the person said something like, I got a dog so I could have protection or whatever. So it was funny. But the point being that pets are goofy. They do funny things. They do things we can't interpret all the time. And so especially having so many people at home now, after the pandemic, those things are being seen more often. And some people might look at that dog and go, that dog's being a goof, but some might actually freak out and go, is there like a brain tumor in this dog? And so those things where people are not medically trained, but that's the decision point for whether or not they go in for an appointment, is at the actual human that owns that pet. And so telehealth allows us to switch that decision point to a medically trained person, where if they call in or type into your clinic and say, this is what my goofy dog is doing, and describe it, they can either defer that over to a nurse conversation where it's, okay, this is probably just your dog being funny. Or if it was a different situation, then get them in either the ER or your clinic, more, for their appropriate care. So that's the first way, is moving that decision point away from the pet owner. The second piece we actually touched on as well, which is taking those cases that don't need to be seen in clinic and bringing them out to a virtual care appointment. And that can be your team, your clinic, if you had a doctor that was available for that. There are also different clinics or different companies that have that service that you can actually contract with them for their doctors to talk to your team, to your clients. And then the third piece is around getting those people who aren't coming into your clinic, giving them an outlet for questions. So if they're calling into your clinic now and you say, bring in Fluffy, and this person doesn't have a carrier or a leash for Fluffy, maybe they're afraid that when they come in, there'll be too much money, they'll have to pay too much, they'll, whatever their fear is, if you talk to them in a very, especially in an asynchronous way, where you're just giving them information saying, this should really happen and I'll walk you through it. It just creates trust with that person that it really is the right thing to do to bring them in or not. So it's just addressing access to care in different ways, depending on the need of that clinic and the need of your actual clients.
And the thing that I love, Sarah, you probably know it about me, but I love making money. It's a bit of a pastime for me, and it's a challenge. It's a way to keep score. And it's a way to bring people together. And so, I've talked to so many veterinarians, and I have so many veterinarians that are friends. And, damn that guy for saying that to you at school, because look at you now. Because telehealth is not a free service. You're providing a service. You're in this to make money, to earn a living. And that's not a bad thing. That's a great thing, because you're helping people and providing a service at the same time. So how do you monetize this? How do you start small? Like, I got 1,000 questions, but like we just had somebody ping in, I want to get started right away. What do I do? So like my questions are their question, which is, how do they start right away? Like, what's a bit of a playbook? What have you guys done at Galaxy? What did they do at Modern Animal? And if we've convinced these people to take a day from their practice and work on their business, what do they got to think about? What's their 5 items on their checklist to get started right away? Even if it's just a small start, like maybe it's not a full-fledged deploy this technology and deploy this, like maybe it's something small. But what would you say to that person? She wants to start, or he wants to start right away.
Well, glad to hear that, first of all. So what I would really recommend for starting would be literally, it sounds ridiculous, but just talking to your team about what the biggest problems they're running into every day would be. So your CSRs, your RVTs, your veterinarians, even if you're brave, talk to a few clients, especially the ones that get a little feisty, talk to them and say, what takes up the most time in your day? What's the most frustrating part of your day? What ideas do you have about making your day better? And then for those clients, when you come into the clinic, what's the most frustrating thing? What's the thing that takes the longest, et cetera? Just interview your team and the people, because you have to solve for both, right? You have to solve for your veterinary team and you have to solve for your client. You can't solve for just one or just the other, because then you screw the other one over accidentally. So if you solve for both, you see what those problems are. You see, are there commonalities or are there patterns within what people tell you? And then you actually call these telehealth providers. There's a list online. You can just go to the VVCA website. There's a whole bunch on there. Talk to a couple of telehealth providers that just offer a platform, and your team would actually service that platform. And then talk to some providers that actually have a team, a virtual team associated with them, and tell them your problems. This is what my team runs into. How would you recommend that I solve this? And talk to them about workflows, talk to them about what it would take to train based on their solution. And don't let them be general. No generalities. No, I want you to be specific about how I would solve this. Have a conversation with a couple of providers. The other people you can talk to are There are telehealth consultants out there. My good friend Jess Trimble, who Shawn also is good friends with, she does telehealth consultations for veterinary clinics. You can contact the Veterinary Virtual Care Association, and I'm sure they can connect you with someone who you can talk to about the problems within your clinic, and start solving for those problems. And the third piece I would say is, so if you find a solution in those conversations, wonderful. Another piece would be, if you're still unsure about telehealth, which our one person writing in isn't, but maybe others of you are, we do have a volunteer telehealth offering that we put together here at Galaxy, which is providing telehealth services to the pets of Ukrainians during their war with Russia. So we've helped over 30,000 pets so far. And all we're doing is having people ask us questions, and then we're talking them through whatever their question is. And these are people that are taking care of pets who are strays because of the war, or people who have relocated because of the war and they're not near their normal veterinarian, or they're not near a veterinarian at all. And so sometimes we're the only resource they have. And so it's a really interesting way to get your hands dirty, if you will, with telehealth and understanding how it can help in a first person way without actually putting it into your clinic first. So if you need that extra step of trust that telehealth can actually help your clients as well, try something like volunteering for our Galaxy Vets Foundation. And that's a great way to
see what you guys have built. Yeah, like, volunteer some time, see what you built, learn from it, and implement it yourself. Sounds like a great win-win for anybody that's interested in understanding a little bit more about what it takes to build something that works. I mean, there is so many companies in this space, and I'm friends with a bunch of them. Like Jess works at Annie Pannion. Tom, my friend, runs PetsApp. There's a myriad of different providers, all pretty damn good. All of them pretty easy to use. All of them adding value to the continuum of care, the access to care issues. I think they all make sense. We're doing questions from me and the audience at the same time in real time, which I like. So we're supposed to wait the questions to the end, but I've got questions, but their questions are better. So I'm just going to ask you this question that popped in. Does telemedicine increase or reduce my liability exposure? That seems like a pretty important question. So I just wanted to jump right in with it.
Yeah, so telemedicine, just so everyone's on the same page, telemedicine, the way I define it, and it's defined by the AVMA, includes diagnosing, treating, or prescribing for a patient. So basically using that veterinary license specifically during a virtual consultation. So depending on, and there's a really nice resource on the Veterinary Virtual Care Association website. It's a big state map where you can pick out your state, and it actually, if you click on, Idaho or what have you, it will actually, it's pulled out the actual laws around telehealth and telemedicine for each individual state. So you can read through those and understand that. Having said that, to start, there are a ton of gray areas in terms of the laws within each individual state. And sometimes the state boards are not super helpful in helping you understand those, although there are a couple of states that have actually gone through and parsed out the law. This is what the law means in terms of what you actually can do in a clinic, which is even more helpful. So I guess my answer, unfortunately, is it depends on where you are and how legal it is there. And if you're in that gray area, what your risk tolerance is there. What I will add on to the end of this statement is if you're always providing virtual appointments and virtual care in a way that's in the best interest of the pet, it's very hard to legally go after someone for that.
Yeah, and I think that's like a really great piece to insert like some measured advice, which is if you're doing the right thing, that should help be a bit of a compass to guide you in the direction of what you're going to do from a telehealth perspective. Like, because the laws and the state boards, oh my God, let's not even start down that road because they're confusing. But I mean, I think it makes sense to understand what you're getting yourself into within the jurisdiction that you're going to offer these services. That's a great place to start. But no matter what jurisdiction you're in, there's certain elements of what we've talked about already today that apply everywhere. Teletriage is a great one. I mean, you're doing that anyways, oftentimes. And if you're not, that could be a great kind of starting point. One of the other people that's in our audience, and we have a super active audience today, so thanks so much for being so active and throwing these questions. I think it's just your natural personality, Sarah. You're so disarming. So people want to ask questions, which I think is great. How do I talk about telemedicine to my clients? Right? Because it's two sides here. It's like the veterinary team that's been practicing veterinary medicine for the same way they've been always practicing, and then the clients that have always been receiving veterinary care the way they've always been receiving it. And just because we had a global pandemic doesn't mean that every pet parent or every pet got to experience some of these new ways of interacting with their veterinary clinic. Maybe they haven't gone to the clinic in 2 to 3 years. So how do we do that? How do we introduce it to our clients? What's that look like?
I mean, that's such a fabulous question.
Well, it's not mine, so credit to the person that asked it.
Oh, I wasn't giving you the credit. So I think that a couple of things. One, I think as a whole, introducing the concept of access to care and the concept of convenience for the pet owner specifically. So I like to talk to people about the dog in the middle of the night that it has vomited twice and otherwise seems fine. And most people will say to themselves, do I need to spend the money? Do I need to get out of bed? Do I really need to? So being able to just ask those questions at Galaxy and at a lot of places that are starting to offer telehealth, that offering is 24 hours a day to at least talk to someone or have that triage conversation, because then that person is equipped with information and a plan moving forward. And then the convenience piece is you don't have to get out of bed to do it. You don't have to, unless that person that you're talking to says, no, you really need to get out of bed. So I really like approaching it from that angle, which is I'm offering this to you so that you only have to get out of bed and spend that money when I actually tell you you have to. So that would be one place to start for sure. In terms of telemedicine, if you wanted to go in that direction, this is a really nice place for things like chronic care appointments. If you've seen a pet for their lab work, but they have a question, if they have, their pet's acting a little bit off and you just started a new medication or whatever the situation is, but it's a chronic care situation, being able to meet with that doctor virtually instead of coming into the clinic for the 9th time this year is probably going to be pretty valuable to that person. So situation.
Can I stop you right there?
Yeah.
Just because I think it's a great spot to interject something that I learned over the last, 20 telehealth conversations, which is not pretty valuable, but more valuable than driving to the clinic to come to see their veterinarian in that particular case. Much more valuable. Right? Like, because my poor pet, like, I don't want to take the pet on that 20-minute journey, interacting with a bunch of other pets. Maybe it's a senior pet, maybe there's all of these other factors. So this is the mind frame to get into. It's not that you're providing a cheaper service or that you're providing a service that has less value. Oftentimes these telemedicine appointments are vastly more valuable because of the experience for the pet, let alone the pet parent.
Yeah.
You're allowing people to meet with you on your own terms as opposed to dictating the terms of that engagement.
Yeah. I completely agree with you. When I have one of the biggest pushbacks I have to telehealth is that it's a lesser quality of care. And I I think that is just a misunderstanding of what telehealth is actually offering, because the value to that person is in the convenience, sure, but it's also in actually having a conversation in maybe a safe space, maybe a calmer space than they would in a veterinary clinic, getting information that maybe they wouldn't get because of the amount of time that they have to talk to that doctor in clinic. But also just having that safe space to ask the questions. There's so many people who would say to me through telehealth, I wanted to ask this question, but it looked like my doctor was rushing or needed to be somewhere else, or it was a little overwhelming, so I didn't want to overwhelm them, or whatever the excuse was, but it just gave them a safe space to be able to understand what's going on with their pet a little better. So when you say, I need you to be on this medication, I don't want people to leave the clinic and say, I don't understand why I have this. I want there to be a resource for them to be able to reach out and say, hey, I got this medication. Can you explain to me again why I need it? Absolutely. Let's do that. Because then you're having pet owners that are more willing to give that medication. They're willing to be more compliant, and they're willing to follow through with your recommendations because they understand them. So the quality is about just having enough time to get them to the point where they understand, a time that it being in the clinic doesn't always allow people to have.
Yeah, I totally agree. Sarah, let's talk about asynchronous versus synchronous communication. This is not a question that is on my list, but it just made me really think about an experience that I had a couple of weeks ago where I had a problem with a tooth and I called the dentist, I think 25 times. And then I drove to the dentist because they weren't answering the phone. And it really made me think about telehealth, teletriage, and it really, I think, is directly applicable to our conversation. So what the heck am I talking about when I talk about synchronous and asynchronous communication?
Sure.
And how does that apply?
Sure. So synchronous communication refers to communication that's happening in real time, sort of like Shawn and I are talking now. Asynchronous communication is more like text messaging, where there's I can write to someone and then they're going to wait anywhere from 30 seconds to 5 hours to respond to me. So there's a gap, or there isn't necessarily an expectation that there's going to be a response right away. And so what Shawn was trying to do is have a synchronous conversation with his dentist, which might have been easier for him if he could have texted or otherwise messaged his dentist and then gotten a text-based response to that message. And what that would allow Shawn to do is get his question out to that dentist, and the dentist could finish whatever mouth he's in and then look at his messages and say, oh, I need to answer Shawn. He's not doing well right now. Send him a message back. And then when Shawn's done with his next meeting, he can get that message and have that conversation. So it accommodates for the busy lives of both the doctors, who often can't be pulled away from procedures, or if they are, then you're breaking their attention span, which is adding to their burnout. And then for your clients, they need to talk to, they either want to talk to the veterinarian or they're calling in and then they get put on hold. And that's creating sort of an asynchronous piece that's necessary. That's the indicator, right? The asynchronous is necessary. That's what on hold is. So if you instead give them a method to actually text your veterinary clinic, then in between meetings, between dropping the kids off at the swimming lessons or what have you, they can text back that doctor and, okay, I need this answered now. Okay, now we're on the same page. We didn't need a phone call.
Yeah, it's fascinating. And so we're like burning through time like no other webinar I've ever done before, Sarah. But I have a couple of like rapid fire questions that I want you to answer really quickly, so I can get some more information out to these lovely people that have joined us. If there's 3 telemedicine companies that people should check out, who are they?
Oh gosh.
All right, I'm going to challenge you.
You're going to challenge me. Goodness. So depends on what you're selling for. So if you're looking for a company that is doing, oh gosh.
3 companies, Sarah. Your time is ticking. Tick,
Oh,
tick,
God.
tick.
I don't think that
I'm
fast.
going to help you. So I'm going to recommend PetSap because I think it's just fascinating. Antipanion. And so you got to come on, give me one.
So PetSap, Anapanion, and I think, no, I don't think that fast.
Okay, this is what I do. I confuse people all the time. We'll move on to the next question. People have come to our webinar. They've listened to what we've had to say. What should be their number one takeaway? If they do one thing.
One thing, their one takeaway should be giving telehealth a chance. And I would start with, if you need to volunteer, volunteer, but otherwise give teletriage a chance, because just watch the difference. Whether it's overnight on call, that would be a huge one. If you have an on-call service, get teletriage on for overnight on call to get those doctors some sleep.
That's so awesome. I think like the work that you guys are doing to help move the profession forward at Galaxy is so interesting. I think we've given people a lot to chew on. It's been super duper awesome. So Sarah, thank you. Sorry for the rapid fire questions. I love to do that to people to throw them off.
I will answer it real quick. The last one would be Animal Health Link would be the last telehealth.
I love it. I love it. We're giving people stuff, which is great. Sarah, thanks so much. Tons of gratitude. Hope we get to come visit you in your new place in Fort Collins, because that'd be awesome. Thanks for being with us. I'm going to do a quick little demo of Talkatoo, and we'll wrap this up. So thanks for being here.
Thanks so much for having me.
You're welcome. So everybody, thanks for staying. I'm going to quickly show you what Talkatoo does. If you've never heard of Talkatoo before, it is this tiny little widget in the bottom of the screen. I just want to make sure. Will, can you give me a thumbs up that you can see my screen? I'm just going to try that again. There we are. Perfect. So Talkatoo is this tiny little application, and we're all about helping veterinary teams get more time in their day. So whether you're a technician, a receptionist, a CSR, or a veterinarian that needs to do medical records, what Talkatoo allows our users to do is put text in any application. It could be a telehealth application. It can be a practice management application. And basically all you need to do is click on Start Dictation and then to speak. So I'll show you how it works. Thanks so much for joining us at our most recent webinar. Sarah is one of my favorite people in the profession, and it was an absolute pleasure to have that conversation. I really hope that you all were able to take something from the conversation. And if anybody has any questions about Talkatoo, I'd be happy to answer them, period. And that, everybody, is literally how Talkatoo works. It allows you to use your voice to get through medical records, client communication, or anything that you may do on a daily basis quicker. I'm here to answer any questions that anybody might have, but that concludes our webinar and our quick little demo of Talkatoo. I really hope it was helpful, and thanks so much for coming. Oh, thank you. We got a fan. I love it. Thanks so much for your comment, and thanks for coming, everybody. Have a great day, and I'll stick around just for a couple more minutes if anybody has any questions. Looks like we got no questions, so have a great day, everybody, and thanks for joining.